How do oral ties impact ear infections? So the way we swallow is supposed to create negative pressure in our ears to help clear fluid from our ears. So if we have an improper swallow pattern, whether that's from a tongue tie or just a low tongue tone, or sometimes if our palate is too narrow and we cannot elevate the tongue to create that negative pressure, then it doesn't clear the fluid from our ear canals. The other thing that happens is if our tongue is not pushing up and spreading out the upper jaw, then all of this anatomy is connected. So if the upper jaw is narrow, then it changes the angulation of our eustachian tubes. So we tend to build up more fluid because of that angulation. Similarly, a lot of times if we have an improper swallow, it tends to also be in patients that are mouth breathers, and then that can lead to inflammation of the tonsils and adenoids. When we have large adenoids, it blocks the eustachian tubes from clearing as well. So what I'm getting at is this like domino effect that starts to happen. And honestly, it starts by a tongue not working properly. So if we can catch that in infancy with like feeding symptoms and get the tongue to really elevate to create that negative pressure, that elevation will also start to spread out our palate. It will also promote nasal breathing. So we'll hopefully eliminate that tonsil adenoid inflammation. So catching these things early is the key by identifying oral ties really early.